Ruth,
Okay.
Professor Ruth Malone. Ruth is a Professor Emerita. She's from the Department of Social and Behavioral Sciences at the University of California in San Francisco. Since 2009, she has served as the Editor-in-Chief of the leading international policy journal of the field, Tobacco Control. She is leading two endgame related projects, the Upend Tobacco California project, funded by California Tobacco Control Program, and a national project exploring state retailing of tobacco funding by the NIH. She is widely known for her research and analysis on the social, political, and policy dynamics of tobacco control and how supply side policies can change the conditions that sustain the tobacco epidemic. It is a pleasure to welcome you to the Smoke-Free Homes Innovation Network workshop today, Ruth, and we'll just ask Jacinta to press record, or we are recording now, thank you. And I'll hand over yourself, Ruth, to screen share, and we'll fingers crossed that at least we'll hear you or we'll be able to get the benefit of your advice. So thank you very much for accepting the invitation.
Ruth, do we have you? Oh no, I thought that might be happening. She's probably going to rejoin just to see if it's any better.
No problem. Just to reassure everybody, I have had a few.
Is it?
Yeah, we can hear. Yeah, we can hear you. Thank you, Ruth. That's brilliant. We'll hand over to you and let you screen share, or what, that kind of what you want to do.
Okay. And I just got another, your internet connection is unstable message. So hopefully this is really going to work. Okay. Can you see that now?
Yeah.
Okay. Now I'm just going to move you guys out of the way here. So when Kate first approached me, I wasn't sure what I was prepared to talk about would fit in. But as we talked more, I could see, and since I know that Ireland has an endgame goal, I'll just give a little talk about what we're doing here and how it might relate to where you're headed in Ireland. I just give a little background on the whole tobacco control versus tobacco endgame concept. Some of the tenacious assumptions that I think we really change to move in an endgame direction. Some of the policy approaches used, California is doing, and some thoughts on messaging, move past resistance to actually do this. So as you know, there are conversations going on all over the world and have been for about people are governments are really actually established. And these are some of the leading countries, including Ireland, who aim to achieve less than 5% prevalence by 2035. Now, whether everyone will make that, we'll see. The United States even has, as part of its Healthy People 2030 goal, less than 5% prevalence, but who even knew about that? We're going to try to work with that, but in the United States, everything is going to happen state by state anyway, as it always does. And so I'm going to talk about California, which actually has a slightly less aggressive, but probably more realistic goal. So what do I mean when I'm talking about endgame? This is a definition that we came up with that we are pretty much using in California. And it change permanently the structural, political, and social dynamics that sustain the epidemic in order to end it within a specific period of time. About structural dynamics, I'm talking about things like the greater number and density of tobacco retailers in disadvantaged neighborhoods. Political dynamics, I think we all are well aware of the effects of industry lobbyists, allies, front groups, other organizations, all work that the industry does to interfere with that role. And then finally, the social dynamics, which is where I still think we have the most work to do. Now, I know you don't have power walls like this anymore in Ireland, but we still tobacco as a normal consumer product that is sold pretty everywhere, despite the fact that it kills when used as intended. So we need to change some assumptions, and one of them is this idea that these are normal consumer products. These are not normal consumer products. These are killer products. These are be allowed on the market today in any country that has consumer protection laws. We also need to change the idea that people have always used tobacco and died from smoking. Yes, people have used tobacco for thousands of years, but not in this particularly deadly and highly engineered form. Only since the machine rolled cigarette was invented in the late 1800s, the aggressive marketing of the tobacco industry, that we really have a tobacco epidemic, or pandemic, I should say. And this is something that wasn't always before. Almost no one died of lung cancer prior to the invention of the machine-rolled cigarette. Prohibition doesn't work. This is one that's trotted out regularly, and Robert Proctor and I have just finished a paper that hopefully is going to be coming out in the 30th anniversary issue of Tobacco Control, kind of taking apart our assumptions about prohibition. Actually, alcohol prohibition in the US, which is what this idea is based on, was effective in reducing consumption. But we think there may be better ways to talk about this. The fact is that this is what governments do all the time for products that are harmful and that hurt vast numbers of people. They stop selling them. Quitting smoking is an individual issue. Again, of course, individuals have to do this, but we all know as public health people that we create environments that make it more possible or less possible for people to do that. If you're trying to quit smoking, but there it is right down the street in front of you for sale everywhere like it's a normal thing, it makes it much harder to push through and really let that go. So the question really is, why is the single most lethal consumer product ever made still sold on virtually every corner? It really does not make sense anymore. So there are a lot of policy approaches that we could take to move toward endgame, regulating the product. I'm not going to really talk much about that, although in the United States, the FDA continues to make vague noises about taking nicotine levels lower or taking menthol out of tobacco products. It remains to be seen if after all this time anything ever comes out of our federal regulation of tobacco. Regulating use, which is where smoke-free policies come in, and we know they have a huge role in changing social norms around smoking and in moving people into having that kind of conversation with themselves where they say, wait a minute, maybe I don't want to be doing this. And then regulating the retail market, which is what I'm going to talk a little bit more about, and that's what we are working on in California. Probably the largest focus now is on regulating retail. So here are some examples of what we think of as endgame oriented policy options. Reducing smoking spaces by expanding smoke-free to parks, entryways, multi-unit housing. We have many cities in California that have passed smoke-free multi-unit housing policies. Reducing the retail availability of tobacco, and I won't go through this whole list, but as you can see, many of these policies have also been implemented in at least one California jurisdiction. I don't believe you have tobacco in pharmacies anymore, probably, if you ever did, but that was kind of a bizarre thing here that finally we've begun to address. But we have 2 cities now that have banned sales of all tobacco products, and another city working on that, and several others that plan to work on that within the next few years. Reducing the affordability of tobacco products is another option. not just tax, but also establishing a minimum price to reduce the chances that the industry is going to manipulate that tax increase and then still shift that so that there are still cheaper products available for their lower income consumers, and raising that minimum price regularly and steeply. The vision in California is a fairly radical one, I would say. By 2035, to transform the state by eradicating the commercial tobacco industry's influence and reducing the harm caused by its products to California's diverse populations. And California has a population larger than many countries and a geographical area larger than many countries and a very diverse population. Yet we are the second lowest smoking prevalence in the country. California's plan, as it has for the last 30 years, is to really focus on local policy change. Now, I don't know that this would work in Ireland, but here, the way we have made progress in tobacco control is city by city, and there gets to be a critical mass, and then the state finally moves when the ground is softened up enough. Supported by a statewide media campaign that's been very hard-hitting and over the years has really foregrounded the tobacco industry's role. So the public here is not a fan of big tobacco. We're rebranding the quit line and enhancing cessation support as we move into the end game phase, providing more resources for leadership from the communities that still have higher smoking rates like Native Americans, continuing to change the social meaning of tobacco use through smoke-free multi-unit housing, retailer licensing and retailer reduction policies, including zoning and some of the other things you saw on the previous slide, flavored product sales bans, and finally, phasing out sales of tobacco products. And as I mentioned, Beverly Hills became the first US city to pass an ordinance ending sales of cigarettes and most tobacco products. There was an exemption for Arnold Schwarzenegger's favorite cigar lounge, unfortunately. But following this, another city, Manhattan Beach, has passed an ordinance ending sales of all tobacco products with no exemption. And both of those went into effect in January of 2021. The sky has not fallen. Nothing has happened. They seem to be progressing just fine, but we'll know more in a little while because there's evaluation data going on. Now, do I expect that this is going to instantly cause prevalence to plummet in these cities? No. This is a much longer term thing that has more of a social norm change effect. Because these cities are located contiguous to other cities that still sell tobacco products. So that's not going to be an instant change, but it changes the meaning of what's going on. And it says, you know, we're fed up now. And amazingly, we find that as we have gone around in cities working to get flavor bans passed, someone in the city council or the board of supervisors will say, why don't we just ban all this stuff? Why are we still selling it? So this question is already out there in people's minds. And these are some of the ways that we think we can talk about this. We made it, we can unmake it. This is an industrially produced epidemic caused by the most lethal consumer product in history. We've lost too many loved ones. We're losing our wise elders. This is worse than COVID in terms of taking away our wise elders and leaving younger generations impoverished. And now tobacco companies are targeting new generations with these whole new sets of products. Level playing field. Other dangerous products are phased out or strictly regulated. They have to meet these standards. We don't think we need a choice to buy lead paint. That's not how we talk about product regulation. And finally, the cigarette century is really over. This isn't a normal business anymore. And this is a conversation that we've started having in terms of retailers. The retailers are not our enemy. They want to make money just like any business does. But as we see prevalence continue to drop, they are not going to be selling much tobacco anymore anyway. So it's time now to plan and prepare for the transition and move forward. And that's something we're working on, is developing some resources to incentivize retailers to feel ready to get out of the tobacco business. We published this paper, which some of you may have seen, making the case for phasing out sales of cigarettes and taking up some of the obvious reasons this won't work and can never be done. But in California, there's actually amazingly high support for phasing out cigarette sales over the next 5 years, almost 70%. But astonishingly, even in the rest of the United States, more than half of the people support the idea of phasing out sales of cigarettes. Now, of course, this is higher among non-smokers and former smokers, but even among smokers, there's fairly good support, and many smokers would appreciate the help because we know 70% of them want to quit. Now, everything we've ever tried to do in tobacco control, as you know, couldn't be done. We couldn't have non-smoking sections in restaurants. We could never ban smoking on airplanes. We couldn't have smoke-free workplaces. And the idea that you could have smoke-free pubs in Ireland, that was absolutely unthinkable and could never be done. But all these things have been done. So as your health minister said, this is a battle that must be won. And it's about starting this conversation and really seriously saying this can't go on this way. We can't just keep nipping at the edges of this. We have to say we're going to end this. And 70 plus years after the first study linked cigarettes with lung cancer, I think it's really time that we had that conversation out loud. So thank you for inviting me, and I hope you were able to hear most of that, and happy to have any discussion if there's time. And if not, again, thanks for having me.
Thank you very much, Ruth. We heard every word, and of course there's plenty of time. So honestly, thank you very much for an excellent presentation. Thank you. And I'm very happy to open it up to any questions that anybody has. I mean, sort of like, please feel free to, you know, Jamie Pierce.
Thanks very much, and thanks very much, Ruth. That's a really great talk, really inspiring, I think, for those of us working in the Ireland and UK context. Availability is an area which we've been working on for a long time, including through the pages of tobacco control, and something we've been pushing also from a policy perspective for a number of years up here in Scotland. I'm at the University of Edinburgh. And despite all the research, all the work we've done in terms of, for example, showing the links between availability and outcomes of behaviours, undermining some of the, trying to undermine some of the arguments about why we shouldn't be doing these sort of things, it hasn't had a lot of policy traction. There's been resistance from policymakers, of course, from the industry, of course, from the retailer associations, but also perhaps more surprisingly from some of the tobacco advocacy groups. So I just wondered whether, from your inspiring talk, what sort of lessons you think we can take, particularly in some of the successes that have been had in California. What can we learn there to try and take some first steps in terms of translating the research, I think the robust research we've got now internationally and in Scotland, into action on the ground and affecting policy?
Oh, well, that's a good question. And, you know, since I'm an academic and not an advocate, I don't have a single answer. We are going to be gathering a group together of all the jurisdictions in California that have said they want to pursue a complete sales ban policy, and sharing lessons from Beverly Hills and Manhattan Beach. One thing, but I think, again, it depends so much on your context, which you certainly know better than I would. But I think one thing is critical to have a champion, as you, I'm sure, know for pretty much any policy. Critical to give them some argumentation. You know, I was shocked at one point when I mentioned the idea that we should phase out sales of cigarettes to someone from the UK, who's a very highly respected policy policy savvy journal person who said, oh, well, we can't have prohibition. That was where she went right away, and this is, of course, based on this US experience. I think we really have to work on deconstructing that somehow, first of all. But I think we, some of the things that I mentioned about saying, wait a minute, hold on, don't we do this with other products that kill people? And doing the social math stuff for people so that they really get that this is about this product. It's not about we have to differentiate the product from the behavior of using the product. It's not the fault of the user that this is a problem. It's the fault of the product. And Robert Proctor writes about how this product is actually made even more defective than it needs to be. So that's part of the conversation, I think, is really pointing that at that product and saying, this is a basic consumer protection issue. This needs to be addressed from a consumer standpoint. And the only reason it hasn't been is because of the historical accidents of the way it developed and was always exempted from consumer protection laws, which I'm assuming was probably the case in Ireland or the UK as well. So I don't know if that rambling answer is helpful at all. I mean, this is something that we spend a lot of time talking about. I think having a policy champion, sometimes possibly, but you already have banned menthol, I think, haven't you? Or have you? Yeah. Which wasn't a big problem probably for you anyway. But I think banning flavors is part of if you can get across the line, banning sales of one tobacco product, I think that helps because it helps people believe that it's possible to do something about these products. And then it raises the question, automatically it comes up in people's minds that, oh, well, we did that, then perhaps we should do this other. Perhaps we should really address the real problem.
Great, thanks.
Thank you very much, Ruth. Thank you. Paul, you had your hand up, and then Rachel.
That's great. Thanks very much, Kate. Ruth, really enjoyed the talk, absolute tour de force. Like I think sometimes there's a bit of Stockholm syndrome in terms of the tobacco epidemic, and we're in it and we don't see it. And I just think kind of, hearing some of the points that you called out there for us is great in terms of reminding us and charging us around what needs to be done. And I noticed in your talk, I think I saw 2035 for the Ireland endgame goal, and actually it's 2025, which is something as a physician working in their health services on tobacco control keeps me awake at night. And actually my question is going to go to that point. Like our recent annual health survey in Ireland suggests, now there's been some changing methods, but it suggests that our declining smoking prevalence in the general population has stalled, and we've also seen some worrying trends in terms of upturn in smoking among school-age children. So back to sort of end game, and what's good for us is that in 2013 there was kind of political buy-in into national policy around endgame. So we have our Tobacco-Free Ireland goal written in 2013 for a 2025 target. But like I am worried as a physician working in the health services on tobacco control, is there sufficient political ownership and accountability kind of maintained around that goal? And then, of course, for the last couple of years, we've had dropped in on top of that COVID, and you almost have to explain and apologize for talking tobacco control when how is that important when we're trying to deal with COVID. Now we're planning, I was interested in one of your slides there, we're planning to run a public opinion poll this year to understand where the public is on thinking around endgame generally, and then specifically some of the tactics. So my question to you is, what would your advice be for those of us working in tobacco control and kind of advocates in the area in terms of maintaining political ownership for a tobacco endgame goal as we have here in terms of our national policy?
Oh, well, that's a big question. I don't know that, again, I don't know that I have an answer for you. I would say having that goal out there is something that certainly needs to be leveraged. I mean, the fact that you have that goal and you don't have much time left, if you're really serious about meeting the goal, or, you know, then you can raise the question of, was this just aspirational? Was this just window dressing? You know, you can really kind of call it out. And I think we're going to have to get hardcore to make this happen. It's not going to be easy for people to move this direction because there's so much that's been taken for granted for so long. But I think saying, look, we've got this goal. We're not going to make it with the measures that we've taken so far. We need to keep doing all those things. And here, I don't want to suggest, and this is a conversation, of course, happening globally too, that, you know, we don't want to back off from smoke free. We don't want to back off from taxes and all that. But at the same time, we have to be having the conversation of, hey, we're not just going to do this forever. This makes no sense to just do this forever. So what additional steps are we going to take? And the FCTC has provisions, I forget which article it is, but 2 point something, that calls for governments to go beyond just the sort of basic things. So I think there may be some further conversations that are going to happen at the global level in the future, hopefully at the next COP about this. But I think, you know, that you don't have a lot of time. So I think conveying that sense of urgency. Now, who you have for your public champions, you've got some great people there. So I think it's just really pushing on them and saying, look, we're running out of time here. We need to be doing this. And we know that smoking and COVID don't go together either. So there's all the more reason to work in this direction. I don't know if that helps.
Definitely does. Thanks very much, Ruth.
Thank you very much for your question. Thank you, Ruth. And Rachel, your question.
Hi, Ruth. Thank you for that fantastic presentation. I really, really enjoyed it. And I can't miss out on the opportunity to ask you this question, but I also don't want to put you on the spot. So for those of us who work predominantly in smoke-free homes work, one of the challenges that we often face is that ethical principles often inform consideration of the issue of children's exposure to secondhand smoke in private spaces, homes in particular. And so there is often this sort of, well, you know, what we can do and what we can't do in a private space. And I can see Sean smiling here, who's also on the call, because I think he knows what I'm going to ask you. I love your suggestion that we need to get hardcore. And in relation to smoke-free homes work, I would love to know your opinion on, you know, we have moved towards policies that prohibit smoking on beaches, in outdoor spaces, in cars, on planes. What's your view, Ruth, on legislation that would ban smoking in homes? Is that too hardcore? Is it aiming too high? Or in terms of moving towards endgame goals, is this something that those of us working in smoke-free homes, research, policy and practice should be contemplating?
Well, I would say certainly for multi-unit housing, it's ethically justified on the basis of not harming others who cannot help but be sharing air, because we all know that the science shows that, you know, it does travel through air ducts and heating systems and all of that sort of thing. And there's also the third-hand smoke issue. So I would say certainly for multi-unit housing, it's a very tricky one. We haven't managed to get it in San Francisco yet, and San Francisco is quite forward thinking on tobacco control policy, but we have a lot of multi-unit housing, which would, you would think, argue for us to be one of the first, because we do have low smoking prevalence, but there are political obstacles always to this sort of thing. But I certainly think that it's ethically justified there. Now, is it ethically justified or even enforceable if it was a private cottage, you know, off in the on the field? No, it's not. So I wouldn't waste political capital on that. But to me, it seems multi-unit housing is a very important place for work to happen. And And I think particularly as your smoking prevalence has gone down, I'm sure people in multi-unit housing are not happy about breathing other people's smoke. And landlords, for that matter, are not happy about dealing with smoke and the residues of smoke. And there's the literature on the value of apartments if smoking is permitted and all of that sort of thing. So yeah, I think that's definitely a place where more work needs to be done to really spell out why this is the right thing to do. Definitely.
Thank you, Ruth.
Thank you very much, Ruth. And I see a hand up from Martina Blake.
Yeah, thanks, Ruth. Very interesting presentation. Fantastic to see some of the work going on in the US. Just to follow up on that point around smoke-free homes and the rights of people to have, you know, clean air. We've had that debate, and we're still having that debate in the HSE around our tobacco-free campus policy. So, for example, you know, we have a policy within the health service to have smoke-free outdoors as well as indoors, obviously. But we also have a policy of kind of decongregation. So where we're taking, say, disability services that might have been, you know, people who have disabilities might have been living in congregated settings, to provide them with housing, supported housing, either in a HSE facility or in a private residence, and, you know, have staff going in to support them. And the debate is very much at the moment, you know, what are the rights of those individuals to make, you know, their own choices, even if they're unhealthy choices, in what's considered their own home. And whose rights are more important? You know, is it the staff member who's coming in to provide that care in those homes, or the individual whose home it is? You know, so that debate is kind of going on. Look, I think we're still kind of in consultation with the Federation, Disabilities Federation, and various partners, but I think we have got agreement at least that, you know, there wouldn't be smoking indoors, even in a private bedroom or in any communal area in an individual's home, but that there might be a space outside if somebody persists. But then the other debate that's still going on is around, is it appropriate for staff to accompany somebody outside, you know, to handle cigarettes for them, all of that kind of thing. And I don't know if if you know any of the detail of that, or in Scotland or in the US, if there's been any kind of debate like that around. It's around smoke-free homes, but it's slightly different.
Yeah, and I haven't really been involved in that policy debate, but I followed it somewhat. I know there was, you know, there were efforts at various times. We did some work on the US military and veterans a while back. This has been quite some time back. And you know, the industry was publishing ads of veterans in wheelchairs out in the snow, you know, smoking their cigarettes and so forth, to argue that they had to have smoking. And I think ultimately it was banned in indoor spaces, but I think they still have maybe some smoking rooms, but I'm not positive about that, or smoking places they can go. But I think we maybe risk, I think this is part of what we need to do, is to change our thinking so that we don't play on the industry's choice turf, because they love that. And we need to pound home, this is not necessarily choice, since we know people take this up mostly as children, and we know this is an addiction, and we know 70% plus want to quit, and the others just haven't figured out they're addicted yet. So, I mean, not to minimize this, and as someone who was terribly addicted, I don't minimize it at all. But I think maybe we don't want to foreground this and argue on the playing field with the frame of choice. I think that's maybe the wrong direction for us to go. I'm not sure exactly what the right direction is, but I think it's much more public health and protection and clean air for everybody, because even smokers like to breathe, which is why smoke-free bars, that, that was embraced after a while. People don't want to go to smoking bars anymore because they actually liked breathing. And so I think maybe de-emphasizing that choice and private space argument and coming up with a different way to frame it that's more public health and clean air oriented. I don't know if that.
Yeah, we have been trying to do that. I think there's another, it's not FCTC, but there's another framework around the ability to kind of, I suppose, make your own choices that, for those who are disabled, say, for example, can make, their own choice, be they healthy or otherwise. It's kind of a European thing. I'm not, I can't remember the name of the framework, but and there's a piece of legislation in Ireland around that as well. So that's the kind of barrier we're coming up against. But I think we have moved some people, even in recent months, just around the debate. So just wanted to kind of put it into the frame there, and just to see if there was any suggestions that you had. But yeah, I think talking about the public health and the clean air is the way to go.
Well, and I think ultimately this is another place to insert the idea that these are not products that would be allowed on the market now. I mean, to start, this is the thing. I think we need to start inserting those ideas strategically wherever we can, so that people begin to problematize the fact that these are still out there on the market. They shouldn't be on the market. We don't allow other products that routinely kill people when used as intended to stay on the market. That's just, we don't do that. I mean, I think of, asbestos. I mean, it may not be banned, but it's certainly not something that you find everywhere on every street corner for everybody to buy. You just don't. You don't find, poisoned food. We don't say, oh, well, let's give people a choice of whether they'd like the poisoned food or the not poisoned food, or do they want to buy the poisoned food? Oh, it's on sale. We've got to really disrupt that. And I think this may be an opportunity to, again, insert that idea that this is about basic consumer protection, and these products shouldn't be there in the first place. So, we don't say we need a choice of lead paint. Those are the kinds of things we need to start saying, so that it softens the ground for people to say, yeah, why are they still there anyway? I mean, when I was a smoker, I used to just think, when are they going to ban these things? They're clearly so bad. And then I realized, oh, there's too much cynicism. They're not doing it, but it's taken all these years, all these decades for this conversation to even be one that public health people can have. So we have a lot of work to do to just have this conversation among ourselves and develop our language.
Yeah, absolutely. As you say, that the world hasn't ended in Beverly, or in where's the Beverly Hills,
Manhattan Beach, and Beverly Hills.
And how do existing smokers access tobacco in those areas? And is there a smuggling, or do they bring them in, or how, from other places?
I mean, as I said, these are cities that are in the larger LA County area, so there are other cities that are practically contiguous. I mean, that are contiguous with them. So they can just go, to the next town and buy cigarettes. But as we know, the more hassle factor there is to go get them, the more people that really want to quit will say, oh, well, that's too much hassle. I think I am going to stick with it this time. So we know that long term, it probably will have an effect. Short term, it probably will not have an effect. But again, I don't see these measures as necessarily having instant public health effects. It's more the denormalizing and the finally crossing the bridge to say, these products are deadly products. We don't want to sell them. We want a healthy community. This isn't who we are. It has symbolic value as well as public health value, and it has value in terms of public health, believing it's possible.
Yeah, brilliant.
Thank you very much. Thank you, Ruth. I think we've one last question there from Tilo Crow.
Yeah, thank you very much for an excellent presentation and good discussion subsequently. So I was listening and I'm thinking about sort of other sort of toxic products, that I could see the tobacco industry sort of looking at that and saying, using that as an argument. For instance, sugar, for instance, sugar drinks and sugar consumption, or we know the National Rifle Association, the firearms, they're a massive hazard, where they say, we're not banning those, we can ban those. So that's one observation, and then the other observation is around sort of. So when I think of Beverly Hills, in my head, it's a fairly, I think of beaches, beautiful, health-conscious people, very aware of, healthy lifestyles, and so that support for, banning smoking probably would, in my view, be naturally very high. But so what about areas where actually high-risk subpopulations live, and where actually smoking has a different connotation, potentially culturally it has, and socially it has developed over generations as something that you do, so it's something where people stand around street corners and say, do you have a light, do you, it's like the water cooler talk, basically on the street, where you have those conversations. So if that is removed, from that population, which what will it be? What will this removal be replaced with? If it has a social function for people to connect, and they perceive it as social capital generating, and if you as an individual step out of that and say, well, I stopped smoking, that's sort of the individual level, and saying, so you're excluded from that social group, which gives you actually a lot of that. So, I mean, I completely agree with sort of the best answer, would be to get the product off the shelves, get it out of sight, get it banned, so to remove it completely so that it's not out there. But so I mean, those are just some observations. I don't see if there are any comments.
Yeah, well, the first thing that I want to mention, because we see this a lot, is that we are not talking about banning smoking, except in smoke-free spaces. So people will probably always smoke. There will be some people who will always smoke. They will find cigarettes or whatever they smoke someplace, and they will smoke them. We are not, none of these ordinances that are being passed criminalize smoking or make it an offense to smoke. Individual behavior is not the focus here, it's consumer protection. So that is the first thing, and it's a really important distinction to make, because people automatically go right to, and we've seen some confusion even among researchers who have questions like, do you think smoking should be banned? Which is a different question than, do you think the sales of cigarettes should be banned? Those are two very different questions. But as to the idea of particular populations that still have higher smoking rates, this is a real concern, and it's part of our endgame planning in California, is to pump more resources into communities that have higher smoking rates, to build grassroots resistance to tobacco and tobacco companies. This is one of the beauties that has happened here in California, just for whatever reason, is that a lot of this work has been led by the Black community, who is fighting to get menthol out. And so they've already built some constituencies. But it is true that these communities that have crossed this line and done this tend to be wealthier, well-off, health-focused communities. So it's really about, it's not as though people can't go out and talk about other things or look at their cell phones, or, I mean, Simon Chapman talked years ago about how is the cell phone the new cigarette, that people can do something with their hands while they're on the street or talking to each other or whatever, I mean, I think the idea that we have to provide the next thing for people when we make it harder to or take away a product that kills them is something I think we have to sort out in our own heads, you know, first. I mean, there's something about that that's not quite right. But we take this up a little bit in our paper. I don't know if you read our paper, but we don't completely, we didn't have the word count to really go too far with it. But I do think there are issues that we haven't yet worked out. I don't say we've got all the answers, but I just think it's a conversation that if we don't have the conversation, you never get there. So it's really about planning. You know, we plan for other things. We plan for construction work. We plan for transportation projects, and we have timelines, and we do certain things by certain times. In the same way, I think it's possible that we can remove these products from the market, but we have to talk about it, and we have to have a plan, and we have to say, and we have to tell people in advance, by this date, we're not going to sell these things anymore. Well, that in itself would be an incentive for a lot of people to try to quit. You know, maybe some of those people standing on the street corner would say, let's do it together, since, you know, they're not going to be sold anymore. Now, in places that have really high illicit sales, that may not be the conversation to have yet. The conversation is first about changing what it even means and disrupting the taken for grantedness. But I think, you know, like I said, we don't have all the answers. We just know that if we don't talk about it, we aren't going to ever have the answers. So, but I think that's part of what we're really trying to do in California is to, you know, for example, with the Native American community, there's a lot of work going on in terms of what they call decolonizing tobacco, because it's been sort of culturally exploited. And they Native Americans have really high smoking rates. So they're trying to unpack and differentiate ceremonial use of tobacco, which goes back thousands of years as a sacred thing, from commercial tobacco, and really turning on a lot of light bulbs in the community, to the extent that some tribes are enacting policies that are very progressive.
Thank you very much.
I don't want to take too much time. This is so much fun. I could just stay here all day and talk like this with you guys. It's so much fun, you know, and I'm assuming you all have seen what New Zealand is doing, which is another thing. The one other thing that I wanted to say is, you don't necessarily have to think, okay, we're just cutting it off. You know, this is the thing. It's not about cutting it off like you're turning off a faucet. It's about, you have a plan. So maybe you reduce the number of retailers first. You sort of squeeze down that space. You also reduce opposition from retailers. Maybe you incentivize them to get out early by giving them some extra money if they commit to stopping selling permanently early. So you gradually are shrinking the space. Or maybe you think about something like Simon Chapman's prescription model, where, you know, you can still get it. You just have to go get it in one place. It's a little less convenient, and you have to have a script for it. And then you get your money back if you quit. Or, you know, there are a whole lot of ways you could do this, but you can't even think about that as long as you just assume it's always going to be there. I hope that all made sense.
Oh, totally. Thank you very much, Ruth. Honestly, you know, I know you said you could sit here all day talking. I could just sit here listening to you. As you said, when I listened to you before, but you know, really and truly, on behalf of everybody who's here and on behalf of all the members of the network, thank you very much actually for coming along. You know, it's 8:30 in the morning with you now, and for actually sharing with us your sort of like expertise and your insight, and providing us with such inspirational talk, and providing more of your time in your responses, your measured responses to all the questions and queries. Thank you so much, Ruth.
Thanks for having me. My internet connection is unstable again, so I'll say goodbye and thank you.
Not at all. I'll be in touch anyway.
Thank you so much.
Thank you so much.
Okay.
Thank you, Ruth.
Ruth.
Excellent.
Excellent.
Bye.
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 Thank you very much.